Hi, it's Julien Barker. I'm here with Lucy. Who's just joined our team, and this is actually the first time she's ever been adjusted, so it's quite exciting. Nothing really going on, no problems as such. So I'm going to run through how we, the speech and the part and what we say when we take a new client through this process, because there are some specific things worth knowing that we include in that. And so for those that have got these procedures, you can always have a look and feel free to steal the ones that we do. Okay. So the first thing is, what I want you to do is get your knees about there, climb up and lie down, stick your nose in the hole. Okay, there we go. So what has been learned over the years in terms of actually when you're doing this adjusting protocol, there are kind of three things that really make a difference on how effective it works and how efficient it is. So the first one, if you're using this, if you've got a high-low, great, use your high-low. If you haven't, if you've got one that just goes up and down, making sure they get on from the back of the couch. Basically, it keeps your spine nice and straight as you're getting on. For some time, people will try and get on from the side. And we're all trained here, and we tell them, you know, when you do that, I'm going to shout at you and make you do it again, because it just makes that initial leg length reading so much harder, and it's just the thing you don't want to get wrong. Okay. So the second thing is checking and adjusting people in their own shoes. What's called the inter-examiner reliability. So it's me checking against me, or if it's one of the other team checking against, or if you had a locum in, they are far more likely to agree. I think the Kappa score goes up to 0.72 if the people are wearing their own shoes, and that is because your postural distortion patterns reflect into your shoes. As long as they've been wearing those shoes for more than about 2 hours, you'll actually see it just makes it easier. So that's the second thing. And the third thing, and the reason I'm just talking now, and this is how we do it and why this is an open plan adjusting room, is I want people lying down as close to 5 minutes as we can get it, certainly beyond 30 seconds. Simply because with you there, it takes gravity off all the load-bearing structures, so that when you actually do the adjustment, it's been shown you get more movement through the joint. And most of those studies are done on lumbar spine, because that's what tends to get studied the most. Okay, so that's the long version. Here's the short version. Get on from the back. Those shoes are perfect. Lie down and chill out because it works better.
Nice.
Okay. So, yeah, and for those at home, Lucy is very clearly a right PD. So Lucy, you are short. It's a solid centimetre. We'll go metric. And when we come up into position 2, this is position 1. This is position 2. You're definitely going from short to long on your leg, which would be the possibility 1, what most people are the most of the time. Okay, so always worth doing this as well. So especially first time, and I have to say I've learned this one the hard way. It's worth saying the tool I've got in my hand, it sounds like this, yeah? And I always pick a finger on their PD side, only because if you're going to accidentally do something by error, you want to input on the PD side. So I was just on the finger, so it feels like that, yeah? Okay? Reason for doing that is because otherwise, if you do the first adjustment and they didn't expect it, they will jump. And then you'll jump, and you're just making it harder for yourself than it needs to be.
Try not to scream.
Absolutely, all that scream, yeah. Which is okay, because as we know, scream if you want to go faster. Yeah. Okay. So I'm going to run through the basic scan, which Lucy's now seen a couple of times, and trying to identify where the subluxation is to do the adjustment, to stimulate the brain and get those changes. But we'll talk through it as we're going along. Okay. Okay, so when I go to the outside of your right knee, so I get a very clear change. 2 points of adjustment for the lateral tibia, straight through your lateral collateral ligament. And what Lucy's probably just found out is the knee ones tend to feel more sensitive.
Slightly.
Slightly, there you go. Okay. And have things changed? Actually, they have changed immediately. So, we move up to pelvis, bit of pressure there, If anything, that makes your leg length change more. Shove it in backside on right side. And if you were thinking, Lucy, it's like he's trying to stimulate my sacrotuberous ligament, you're spot on. That's exactly what I'm going for. Okay, so 3 points of adjustment. 1, 2, spinal ischium, sacrotuberous ligament, and then into the iliac fossa, through the glutes, and aiming very much at your sciatic nerve. Good, actually things have levelled up there. Squeeze your knees together, and there you go. Which is a test for the PS, yours is fine. Okay, so right hand up behind your back. Swap your hands around. Both hands up behind your back together. Both back down by side, so clear L5. So, world at this point, Lucy, is divided into 2 types of people. Those that want to know all the detail about what I'm doing, and those that just want me to get on with it. Honestly, which one are you?
Of course I want to know everything.
Of course you'll know everything. Okay, so I'll talk you through. This is an L5 adjustment, and I'll just talk you through. So, top of iliac crest, come across. That one's always lumbar 4, so count 1 down, that's lumbar 5. I'm coming across onto the inferior articulate process. Put the tip of the tool in position. 8 pounds of preload pressure, definite pause, deliver the thrust, pause and release. Yeah? You felt it?
Yes.
Yeah. Okay, so it moves that L5 vertebra from the start as it's been done. It's 1.8 millimeters in exactly 10.4 milliseconds. You felt it, so that voltage actually jumps across to the other side of the spine, whizzes up and then back through the cerebellum and then into the sensory and motor cortex. The voltage where it's measured is 3,363 millivolts. And in the studies looking at brain scans, basically those, the cerebellum, sensory motor cortex, it lights it up like Christmas. That is what changes the neurology. Locally, there's a release of anti-inflammatory interleukins into the spine. Interleukin 10 has been shown. And also there's animal model studies which has shown an increase in bone mass for those that have osteoporosis in animal model studies. All good to know, yeah? So, another one from the psychologist is if you're in a flow state, whatever you're doing, you're probably doing it better. So from here on, I'm just going to shut up and go through it, okay? So, right hand up by your face. Big deep breath in and out. Left hand up as well. And both back down by sides. So, T8. Setting 3 this time. Okay, turn your head to the right. Lift the right shoulder off the couch, back down. Shrug both shoulders up to your ears and down. Okay, shrug the shoulders up and roll them back. Okay, squeeze the right elbow flat against your side, and let go. Squeeze the left one in, and let go. That's all good. Head back into the centre. Lift up your head, back down. Tuck your chin down to your chest, back to centre. Push your face down into the couch, and let go. Okay, turn your head to the left. Head back into the centre. Stretch your right hand towards your right knee, and back round. Left hand to left knee, and back round. Okay, so as you'd expect with somebody that is asymptomatic, there's stuff going on, but not too much stuff going on. What I can feel is there's definitely some tightness in your left leg, down this left side. I don't know if, are you aware of that? When I'm lifting up the leg, it always feels tighter on this side, okay? So I just check through some of the leg stuff, but normally I would actually, first 4 times we see anybody, we would stop there. I just want to run through and check this leg just to make sure there is nothing going on here. It should be pretty obvious if it is. see, it's internally, it's supposed to be a greater trochanter. So. One. There. Okay, so that's how we run through, and that's the first assessment and first adjustment, should I say, the session that we do and how we go through it. So hopefully I'll see you in clinic or see you around, or put your comments below and all of that. Oh yeah, like and subscribe, that's the thing as well. Yeah, that'd be good.